Hello everyone. I wanted to take a moment to go over Chapter 4 whole body terms, as some of them can be confusing. Alright, let's start with structural organization. We have cells, which are the smallest, most numerous structural unit, followed by tissues, which is a group of similar cells with specialized function. Notice that tissues are made up of groups of similar cells. All right, this is an illustration of the component parts of a cell. You can also find this in your textbook. All right, we're going to continue on structural organization. Our organs are tissues arranged together to perform a particular function. Notice that organs are made up of tissues. Then we have body systems, which are organizations of different organs to perform functions of the whole body. Notice that these are made of organs, so yes, you should see a pattern. Cells make up tissues, and tissues make up organs, and organs make up body systems. Body systems include integumentary, which is the skin, skeletal, those are our bones, muscles and joints, nervous, which send and receive impulses from the central nervous system, cardiovascular, I'm hoping you know that's your heart, respiratory, breathing, digestive, that would be your stomach and your intestines, urinary, you also have, that's your bladder, and then special senses, like your touch, see, smell, all those. Endocrine, blood and lymphatic. Endocrine, I want to go back to that for a second, those are your glands, so that has a lot to do with your hormones, your pituitary, your thyroid, all those. Blood and lymphatic, and then your male and female reproductive. As I like to say in class, you know about that one because that's how you're here today. Alright, terms related to cells. Anaplasia, aplasia, dysplasia. Dysplasia, or dys I should say, is a prefix that I was trying to drive home because there's DIS, which is to become free of, think of like dislodged or disconnected. And then this is DYS, which is, it could be painful, bad. So in this case, it is an abnormal formation. Hyperplasia, think of hyper, that's an excessive formation. Hypoplasia, remember that's below and under, so that's less than normal formation. And then neoplasia, which means new formation. All right, types of tissues. Connective tissue, it supports and binds body tissue. You can think of like in your ligaments. Epithelial, it covers internal and external organs. Think of if someone was having surgery and they remove the stomach or the liver. If you notice, there's a shape to it because of that epithelial tissue that's holding everything together. Then we have the three types of muscles. We have skeletal, which attaches to bone. We have smooth or visceral, which is the walls of the hollow internal organs. Such as your intestines, those are smooth. Cardiac is muscular wall of the heart. The reason why I want to break this down, we're going to go over it again in muscles, but I just want to lay a foundation so that when we get there, you can kind of have something to link it to. So in this case, skeletal is what's called a voluntary muscle. We have to tell it what to do. Kind of like, think of if you volunteer somewhere, you gotta go see someone and have them tell you what job to do. So think of skeletal muscles that way. They're voluntary. You have to tell it what to do. Smooth or visceral muscle, that is an involuntary muscle, which means you don't have to think about it. So think about when you eat and your intestines. Do we have to tell our food do we have to tell our intestines that we want it to move the food? We don't. So that's an involuntary, it's an autonomic thing that happens. And then cardiac is its own because it's kind of like a blend between the two. It's striated, but it's not voluntary. It's involuntary. We don't have to tell our heart to beat, right? Thank God, but I'm just saying. So think of cardiac as kind of like the hybrid. And then finally we have our nervous tissues, which transmit impulses. All right, so the question here that we have is what is the smallest structural unit leading up to blank, which performs important bodily functions. So what we're looking for here is the beginning and the end. So if you said C, you are correct, because cells are the smallest, leading all the way up from cells to tissue to organs to body systems. So body systems is our largest. All right, next question. Of the 4 types of tissue, how many do you think are involved in body systems, such as the digestive system? Give you a moment. If you said 4, you're correct, all 4. So we need what kind of tissue to create the organ structure? The epithelial tissue. And then what kind of tissue moves the food through the organs throughout the body? Remember, it's moving, right? That's your muscular. All right, and what kind of tissue is required to stimulate the muscle activity? Think of the stimulation, that's our nervous tissue. All right, and then what tissue is needed to hold the structures in place? Our connective tissue, right? We're connecting it to the area that it needs to be held in place. Awesome. All right, now we're going to move on to body planes. So for this first one, we're going to start with mid-sagittal. And you should remember that mid means what? Middle. I mean, it's kind of simple. All right, the mid-sagittal plane can also be called the vertical plane. It divides the body into equal right and left portions. Our main clue we want to keep with mid-sagittal is this equal right and left. And then we have the midline of the body, which is exactly the line where the plane would be. Our directional terms that we're going to use with this is medial and lateral. So medial means we're going to be moving towards the midline of the body. Lateral means we're moving away from the body. Remember, latero means side, so we're going towards the side. All right? Here is an example. It's also in your textbook with the mid-sagittal plane at the midline. And then there's our example of medial going towards the midline and lateral going away from the midline. Next plane I want to talk about is the frontal plane. You can kind of help, I call it the frontal, you also hear it called the coronal plane, but I like to say frontal because it helps you remember that there's a front and a back. It's also called the vertical plane. So here's an example. Now in this case, our directional terms are going to be anterior and posterior. Think of ante, which is A-N-T-E, instead of anti, not against. Ante, as in A-N-T-E, means in front of. So that means we're going to start in the front and move towards the back. Posterior, post means back, behind. So we'll start in the back and move towards the front. So that's the direction in which those go. All right, our next plane that we're going to talk about is transverse. It's also known as the horizontal plane because it cuts across. And then our two, I don't want to say that our directional terms are superior and inferior because to me those are just destinations. That is not an actual direction. A direction would be cranial or cephalic, and then our inferior direction would be caudal because we're going towards the tailbone. So here's an example. So remember what I said about superior and inferior. Superior is basically anything that's above the top of the plane. And inferior is anything that is below that plane. So that's what I mean by it's a destination, not really a direction. So our direction technically would be cranial or cephalic, and then our direction for going down would be caudal. True or false? A frontal view is when you divide the body into equal left and right portions. False, because that's when you divide the body into front and back portions. All right, so true or false? A radiologist dictates a craniocaudal view was performed. This means the film was shot from the top of the head downward towards the tail. That one is true. Remember that cranial means skull, that's your cranium. And then caudal means tail, which is your tailbone, right? All right, now we're going to talk about the 9 body regions. You do want to know these. You will be asked about them. So you have your 9 abdominal regions. They're identified left to right. Now that is going to be your left to right. And the reason why I'm saying that is because later on we're going to be talking about, and actually when we label this, we'll be labeling it for the patient. But we're going to number the regions for us. So we'll identify them from left to right. one row at a time and move from top to bottom. On this next slide, I'm going to show you how that looks. In this instance, you have your 1, 2, 3. Remember, going from our left to right. Then we move down and do 4, 5, 6. Again, our left to right. And then we move down and do 7, 8, 9. Our left to right. Now, when we're looking at it, though, and if we say a patient was having pain in region 4, that's their lumbar region, but it's the right lumbar region. Even though we labeled it on the left, remember, everything's mirrored when you're talking about a patient. So anything that pertains to the patient is going to be their direction. Anything that pertains to what we're doing, that's our direction. At the top, we have the hypochondriac region. Don't get this confused because it says hypo. Don't think it's below. And in all seriousness, I'm going to draw a little box around where your actual 9 regions would be, because this kind of goes a little farther into the chest and below your inguinal region. But hypochondriac, chondriac means cartilage, so this is like below the cartilage. That cartilage that we're talking about is actually a muscle, and it's your diaphragm. Okay, so hypochondriac means below the diaphragm. So even though it's hypo, keep in mind it's at the top, not the bottom. All right, and then we have our epigastric. Remember, epi means above or beyond. So we're talking about gastric is stomach, right? So it's above the stomach. So that makes sense. So we have our right hypochondriac, our epigastric, and then we have our hypochondriac region on the left. So our next would be our right lumbar region, our umbilicus or umbilical region. That's always going to be our middle center point. Then we have our left lumbar region. All right, and then on the bottom row, we're going to have our right inguinal. Inguo means groin. And then in the middle, we have hypogastric. So this is where our hypo will actually go below, because we're talking about below the stomach. And then we'll have our left inguinal. You'll also hear the inguinal region referred to as the iliac. You'll see that later on. All right, that's the end for this part. I'm going to go ahead and make another part that you can view after this. Thank you.